So I'm going to actually talk today. Ian said earlier, what have we done? Well, this is what we've done in our CCG. I'm up in North Lancashire, just on the border with the Lake District, and I'm a GP there 4 days a week, and I also sit on our on our CCG as lead for patient and public engagement. I also represent GPs on the BMA for Lancashire and Cumbria. So some time ago, and I spoke last year about some of the issues that we were dealing with. We realised we've got major issues, as everywhere, with increased demand at the front line. We're absolutely snowed under with work and patients, and we had to do something. I know GOPA very well, and we decided to move forward. And in our area, we've got some fantastic places, and that canal is Lancaster Canal, just around the corner from where I live. Carnforth Station there on the top right is where they filmed Brief Encounter, actually. And that's just next to my surgery. And Eric Morecambe's statue there next to Lancaster Castle. So a wonderful place to live in. But we decided we wanted to make a real difference. And we decided to go ahead with a pilot on self-care awareness for patients. And the remit we went for was we wanted to reduce attendance for minor ailments in general practice, so increasing self-care, and reduce prescribing for over-the-counter medicines for minor ailments. Drug budgets are spiralling upwards in their cost, and it's an issue we all want to try and to deal with. But also trying to engage nurses, doctors and others in self-care, and we use the Royal College's very good e-learning programme to roll out education. And also using the patient participation groups, which is a very important way of disseminating information. And also using local and national self-care campaigns. So this pilot that we set up was actually the first one with CCG agreements. I took it to the board of the CCG, and we got agreement to move ahead with it. And this pilot, it's cost nothing virtually. So we talk about resources for doing this, resources for doing that. This has been done on virtually no money at all. So it is possible to make differences without spending huge amounts of money. Working up to December last year, when we began the pilot, there was a huge amount of work being done, and I was very grateful to GOPA and colleagues at SheKnew in what was then the Strategic Health Authority. And without their input, really, it probably wouldn't have worked, because that was absolutely vital. And we had a launch event in Lancaster at the locality, and the practices that we had identified, 4 practices came forward and wanted to work with a pilot. We didn't want to push it out everywhere to start with. We wanted to do a pilot. And we initially did an audit of the conditions presenting, and we wanted to know what were patients turning up with, what minor ailments were they coming with that could perhaps be dealt with by self-care. So we knew where to sort of target and look at. And also we wanted to look at what prescribing was like for things you could buy over the counter, like paracetamol, ibuprofen, antihistamines, before the pilot began, and then we'll do a pilot at the end. We'll do an audit at the end and see if there's a difference. Now the fact sheets, you've got them on your table in the spiral binders, are the ones we're using in our practices. And they are brilliant, they really are. There's 13 of them now, they started with 10. And I would encourage you to sort of disseminate them far and wide, because they've got the right information there on 2 sides of A4 of what patients should do and what to know about an illness and what to do next time if you get it. That's the important thing. Next time you get your cough, do this, this and this before you seek health advice. So look at those sheets, they're brilliant. The pilot will continue for 18 months, and as I said, we will re-audit the figures and also prescribing of these medicines. Now here's the top 10 conditions that we found in our pilot. We did the audit over a week in 4 practices, mainly at the sort of same day surgeries with nurse practitioners, and GPs are on call. So the figures on the right may not seem huge numbers, but these are the main ones that presented that would be amenable to self-care. And as you can see, the top 3, for example, make up 50% of the presentations. Of course, there were lots of other illnesses that were appropriate to come to see the nurse and the doctors, but sore throat, cough and common cold were the top 3, and that's really where we want to focus our attention to sort of try and get people not to come. And we do have patients who come and say, I've had a cough for an hour, doctor. What do I do about it? This is true, so there's a huge amount of education needed there. So it's not just your 3-week cough, it's 3 minutes sometimes. So, talking about how was it in reality? What was it like to do this? Well, the timing wasn't great, but I mean, with the transition into the new CCG, the PCT diminishing, lots of staff leaving, it made it quite difficult to sort of roll this out, and there was virtually no staff around because they were either being made redundant or they were moving to different jobs. So that wasn't great. We had to move on and get it done, but that was just one issue. But hopefully now we're in a more settled period. You know, in a fledgling CCG that, you know, was trying to find its way, get through authorisation, and, you know, focused on finances. But, you know, fortunately, you know, we've got the agreement to move forward with it. The practice is actually getting them on board wasn't as difficult as you might imagine. You know, they all realise there's huge issues out there around demand and workload saturation. So getting those 4 practices, one of which is mine, getting those 4 practices involved actually wasn't that difficult. And the training, you know, as I said, it's online. You know, it's a really good Royal College online training package. Actually, getting that out and getting people to use it wasn't difficult, and it helps towards your CPD and revalidation, of course. Of course, trying to keep practices to continue doing, and that's always tricky, isn't it? So, you know, send regular messages out to sort of just remind people about the pilot, remind them about the leaflets, and just to sort of keep it in their mind at the forefront, because when you're in a busy surgery seeing 20 patients in succession, you're not always thinking about giving out leaflets, and, you know, it can just slip your mind because you want to just get on and get to the end of your surgery. So just regular messages and reminding in a sort of gentle way is quite helpful. Well, I think finances can be an issue around such projects, but as I've suggested to you, this can actually be done on a very sort of low budget. And the fact sheets are there on the internet, on the Self-Care Forum website. They're easily printed out, so, you know, that's not too much of an issue. Yes, you've got to print them out, but you know, it can be done. And changes in attitudes, that we are seeing this, and we're seeing doctors are more aware, nurses are more aware of self-care, more aware of the leaflets and the difference they can make. You know, hopefully we'll see a reduction in those top 10 numbers and see less of them when we do our audit, but time will tell on that. But we are getting interest from other practices, so they are saying, oh, we're interested in this pilot, and can we use the leaflet? Well, of course you can use the leaflets, you know, anyone can use them. So, you know, I do promote that website and where they are to other practices. You know, and other CCGs that I talk to as well, they're interested in this because they see it as a great way of managing demand. and obviously conferences like this and telling other people, the more publicity the better, you know, because we really can sort of move on and make a difference here. So what we're planning to do next, we'll be encouraging clinicians, as I said, you know, reminding nurses and doctors about the pilots. We have got quite a good sort of relationship with the media departments locally, so, you know, the health messages are getting out there. We're doing press releases. For example, one's gone out today about this conference locally, and me speaking here, and the local press will hopefully pick up on that as a message. And European Antibiotic Awareness Day is next Monday. Again, that's another press release we'll get out. And I think the local press quite like messages about what's happening in their locality, about practices and identifying with individuals, and it's a really good way of getting awareness increased. We're actually going to sponsor some health messages on the local radio as well, because it's another area that people listen to a lot, and for a very small cost, I'm going to record a few health messages, and they'll go out on a regular basis in their sort of advert spaces, and I think that's another great way of getting messages out there. The pilot now we're sort of up to 12 months now, so next summer we'll be completing the pilot, and those audits will be completed. And maybe next year I can tell you all about those results. Department of Health, well, can we get them interested? Well, we heard earlier, didn't we, the fine words from Earl Howe, but, you know, I think we do need more of a commitment from them. I got to know him very well through an organisation called Developing Patient Partnerships, which was a brilliant charity that did fantastic campaigns around using your pharmacist and knowing your cholesterol level, and that was funded by the Department of Health, and the work they did was amazing, but the funding got just taken away. You know, the rug was taken away from beneath us, and that's now gone. And there's, you know, the Self-Care Forum is doing brilliant work, but it needs more commitment and funding from the department. I would urge the department and Earl Howe to make a commitment. This will make a difference to the NHS and to patients and to the doctors and nurses working in there. So I'm asking the Department of Health to make that commitment